Okay, so you're welcome to today is Anthony Lerno. I hope I got that right.
Yes, you did.
Okay. So I am Agatha. I'm an EAF with EAF, and we're having this panel session, because of our festival, which is our festival for 2023. I'm going to introduce you. I'm going to introduce Runcie. Runcie Chidebe is a cancer control advocate, a global health consultant researcher, psychologist, and a social entrepreneur. He has devoted part of his life, energy, time, and creativity to caring for indigent cancer patients, providing free breast and cervical cancer screenings to rural women, raising millions of funds for the poor patients, engaging governments on policy advocacy, training for nurses and doctors on oncology and cancer awareness in local languages. He is a known global advocate for global health inequity and injustice. He has worked in different continents, including Europe, America, and Africa. He sits on diverse advisory and trustee boards in Switzerland, the United States of America, the United Kingdom, and Nigeria. Runcie believes that geography should not determine whether a woman lives or dies from cancer. Though through Project Pink Blue, he's changing the way Africans think about cancer every single day. So Runcie, you're welcome to this session.
Thank you so much. I appreciate it.
Yeah. Okay, so I and Anthony will be asking you a few questions. And can you tell us more about Project Pink Blue and how it has impacted lives?
Okay, thank you very much. I'm really delighted to have been invited to attend Engage Africa Foundation Festival. I think it's such an amazing platform to really, galvanize action, bring people from different parts of the world to really share ideas and, co-create ideas that could really improve life and development in the continent and even in other part of the world as well. So your vision really aligned with our own vision. Project Pink Blue really started with that vision of, bringing people together to solve our problem, because the incidence of cancer is really increasing across Nigeria, but very little it's really done in that area. So what we do at Project Pink Blue is we actually work with a number of volunteers. We have over 1,000 volunteers. And we have our staff and our board members. And we really provide cancer awareness. So we create awareness. Every year, we host 2 big events, one in Lagos, one in Abuja. The Abuja event is called the World Cancer Day. And through the World Cancer Day, we have over 3,000 people walking on the street of Abuja to create awareness. And we also have the Pink October in Lagos, where we have over 2,000 people walking on the street to create awareness. And we also have what we call Upgrade Oncology, which is our flagship program that we created because we realized that sometimes patients really, you can create awareness and people can go to the hospital. And after reaching the hospital, they are not able to get better care, quality care. And it's not really the fault of the patient that they are not receiving better care. It's also not the fault of the doctors and nurses that they are not giving better care, because you can only give what you have. So if a system doesn't have quality care, quality health care, if the system is really poor, then you definitely breed poor care. So we started Upgrade Oncology, and we partnered with the US government to bring US experts from the US to come to Nigeria to train the Nigerian cancer experts. So in 2018, we brought 2 American professors who came to train about 44 Nigerian medical oncologists. In 2021, we also brought 2 who came to train Nigerian pharmacists. And this year, we also did the same. We also trained about, I think about 100 pathologists. So we also have other programs around cancer policy. My organization, Project Pink Blue, was among the frontliner that really advocated for the federal government to start up what we call the National Institute for Cancer Research. And the National Assembly signed the bill. And right now, we're very delightful that the President Muhammadu Buhari signed the bill, and after the National Assembly passed the bill, and now the bill is being implemented. So we're doing a number of work, around policy advocacy, cancer control, awareness, and all the rest of them.
Great. Okay.
Thank you. So, Agatha, moving forward, the next thing that I really want to talk about is the goals that underpin health advocacy. So protection of the vulnerable and empowerment of the disadvantaged. Can you tell us how these 2 techniques have helped health inequalities, just in your line of work?
So, you see, the thing you really have to understand is advocacy, right, to me, is totally different from awareness. Well, these 2 are all relevant. They're all powerful. And what I've seen is that people really do a lot of awareness creation, in terms of the right issues. If you talk about right issues, are so many across Africa. But when people do, is that people create awareness and talk about how bad it is, how deplorable the system is, what we can do to change it. This is all awareness. Once that information dissemination is targeted at the public, that is awareness. On the other hand, advocacy, on the other hand, is targeted at policy change. Advocacy could be really that mechanism through which you are asking for a change in the system, a change that could be sustainable. A clear example of an advocacy in a right-based issue or in a health promotion issues could be like trying to push for a law on gender-based violence, a law to protect women against gender-based violence, a law to protect, anything. And when you're pushing, educating people about this law, pushing for the lawmakers, pushing for the executive members of the government to really make a difference, that is advocacy. So it's really, really important that people understand that in as much as awareness is good, from my own personal experience working in the area of cancer control, I feel there is a lot more to do in advocacy than in awareness. If we can invest more in awareness, if we can have more organization pushing the government to do the work that we're doing currently, we can really make a difference. I will tell you right now, my major goal at Project Pink Blue is that I want to lose my job. The job that I'm doing right now is I'm providing free cancer screening. I can tell you, since we founded Project Pink Blue in 2013, we've provided over probably 5,000 to 10,000 people with free cancer screening. And we've been existing for over 8 years. But think about if we have been able to get the government to start a national screening program. That national screening program in 1 year can screen over 1 million people. So advocates, activists around the world need to begin, especially in Africa, need to begin to rethink work they do. Will this be sustainable? Is it just to make a difference in a small number of people and you all envelope it that you've made a huge difference? And what I'm saying is not to underscore the relevance of awareness, but to really say that we need to begin to think of what can we do that will be more sustainable? What can we do to help us push for progress so that by 2030, we go back to the United Nations meetings, we can really report and say, this is what we've been able to achieve in terms of the target for the Sustainable Development Goals. So there's a lot that can be done, but I think that advocacy, it's really something we need to do. It's something we need to invest more in. Many organizations, many nonprofits across Africa and even across the world are not really skilled in advocacy, because advocacy is such a difficult area. Sometimes you could get arrested, sometimes you could get blacklisted in some ministry, assuming that you are always talking about how bad the Ministry of Women Affairs are not speaking, are not protecting women. The ministry could decide to blacklist you. And if they blacklist you, you'll find it very difficult, right? Getting to know what the government is doing. But those should not be the barriers. You have to continue to push and lift the voices, use different tools, use innovative tools to ensure that your voice and the voices of the vulnerable that you are advocating for really counts.
Okay, thank you so much. I liked that you said advocacy is targeted at policy change, which is actually very vital. So can you tell us the impact that you think advocacy and right-based approaches has made as regards health promotion?
Oh, there is a lot of, we've seen a lot of progress, especially. I will give you a clear example, and this example is an example that is being used all over the world right now. In 2020, Dr. Tedros, the WHO Director General, launched a strategy known as the Global Strategy for the Elimination of Cervical Cancer as a public health problem. Cervical cancer, as we know it today, really impacts young women and also impact older women. Today, cervical cancer is really no longer a public health problem in countries like Australia, in countries in Europe, in many countries around even, US, in different states in the US. But cervical cancer is still killing a lot of women in Africa, in Asia, and other low and middle income countries. The power we have for cervical cancer is that cervical cancer have a vaccine that if you can vaccinate your population, you can clear cervical cancer. Unfortunately, the vaccine that is needed for a country, for instance, Nigeria, because 50 million women are really at risk of having cervical cancer in Nigeria. The vaccine you need to vaccinate 50 million women in Nigeria will be the same vaccine you need for like 3 or 4 European countries. Unfortunately, Nigeria does not have the kind of financial capacity that will be needed to buy these vaccines or even to patent them and start up a manufacturing company because of the volume of our population. While the other European countries have the money, they can buy up the entire factory and vaccinate their girls and protect their girls. Now think about this from a sexuality point of view. Many women could really get infected by cervical cancer through sex, and they can get that infection from a man. But most men, men generally don't have ovary. Men don't have an ovary, men don't have cervix, so men cannot have cervical cancer, but they can give it to a woman. So think about this issue now as a clear global health problem that requires health promotion. And think about the issue of HIV/AIDS. When HIV came up, because HIV is infectious, the entire world joined. In fact, a very clear example of how advocacy and right-based approaches can help health promotion is when you compare HIV and cervical cancer. You can see how different countries of the world pull together, work together to fight HIV. United States, for instance, had what they call PEPFAR, which is the President Initiative to fight HIV/AIDS. Nigeria, for instance, have a presidential initiative. In fact, the presidential initiative for AIDS was what Obasanjo transformed into the National Agency for the Control of AIDS, NACA. Today, NACA has a budget of millions of dollars that fought HIV. In fact, through NACA, which is National Agency for the Control of AIDS, Nigeria today have made massive progress in HIV. Over 90% of Nigerians who have HIV know that they have HIV, compared to 10 years ago, that about 90% of people who have HIV did not know they have this infection. And why did we make this kind of progress? It's because of advocacy. It's because policymakers came out. It's because global leaders came out. If you go to UN organizations, we saw HIV patients on the streets marching. We saw people carrying placards. We saw people having a walk every single day, using those right-based approaches. What is right-based approach? Right-based approach is speaking to this is our rights. We have the right to health care. We have the right to live. Today, as I speak to you, the right to health care is a human right. But in many countries, in Zimbabwe, in Botswana, in South Africa, in Nigeria, many people cannot afford health care. But it's their right to have access to healthcare. But they can't afford it, and they die because of their postcode, because of where they live. Same is applicable to women. So we have women who have the same cancer in Lagos. The same women, another women also have cancer in Boston in US. Another woman also have the same kind of cancer in Lisbon. Another one in China. But if you cross-tabulate these whole women, you realize the women in US, the women in Europe would survive more compared to the women living in Botswana, in Zimbabwe, and all the rest. Why? Because of what they have access to. So the problem today in the world is that, where people live is really determining or influencing who survive from care, or who survive, or who even have access to any care. So clearly, advocacy and right-based approaches really changing a lot globally, both on a large scale, on a medium scale, and all the rest. We just need to push more. We need to push more and engage more.
Thank you very much.
Yeah.
So to ensure healthy lives as well as promoting well-being at all ages is the third goal of Sustainable Development Goals. It has a target to reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment to promote mental health and well-being by 2030. How well do you think that Africa is faring in this regard? A loaded question, right?
Yeah, thank you so much for asking that question. Well, unfortunately, not just Africa is not on track to achieving that target, and this is one This is one thing many people will not want to hear, but that is the truth. Africa is not even on track to really achieve that target, let alone of being very close to achieving the target. The target we're speaking to today is just less than 7 years from now. As I speak to you today, so many people are dying from lots of non-communicable diseases. Diabetes today is killing a lot of people today, right? And if you think about diabetes, for instance, you realize that we have the tool, we know what we can do. But the problem is we have this massive conflict of the industry playing a key role in pushing back what we can do to mitigate the fight against diabetes. Let me give you a clear example. Sugar sweetened beverages, right, is actually one of the leading factor that really increases people's risk to diabetes, because a lot of people intake sugar and all the rest. Nigeria today is one of the highest, is one of the country with the highest intake of sugar sweetened beverages. So many countries across the world have implemented what they call pro-health tax. This pro-health tax is like, sweetened beverage are being taxed maybe like 10 naira, additional 10 naira, to get more money from them in a way to ensure that sugary drinks are more expensive, so that whatever money the government is able to generate from that sugary drinks, the government can invest it in health, right? By that way, if I have diabetes, I need to buy insulin. The insulin can be cheaper for me. An insulin that could cost maybe $100 or $200 could now cost $50, and I can have access to it. Other medications that I need, I can have access to it. So you see how the pro-health tax or the SSB tax could help. Unfortunately, in many countries in Africa, the sugar-based industry, the bottling companies and all the manufacturing companies are fighting this tax. They are empowering legislators. They are empowering vice presidents. In fact, we had a vice president of Nigeria. The previous vice president of Nigeria was even marketing for Coke, was promoting the brand, unfortunately, saying how he used to drink Coke, how he used to drink, the soft drink. This is the particular issue we are having. So we have this massive industry influence on the fight of non-communicable disease. And that is a big problem for helping countries like in Africa to really achieve this. Then let's talk about other issues that really revolves around non-communicable disease. Talk about the area of cancer, right? How can we be talking about achieving this target by 2030 when so many women are not able to have access to the treatment that they need? It's almost impossible. How can we be talking about that there is a chance for we to really, mitigate this, be able to achieve this target when so many women till today cannot decide for themselves, access to the healthcare they need for themselves? So I really, really doubt if we're on track. But also we have to also acknowledge the impact of COVID-19, the impact of so many violence. We've had Nigeria have experienced some of the worst violence, especially in the Northeast, where so many families that's supposed to really be together have been decimated because of the terrorist attack. We've also had COVID-19 that pulled the progress back, So we have conflicts here and there. We have conflict in Senegal that happened just a few weeks ago. We have the one currently ongoing right now in Niger, So all these conflicts and all these issues really are huge, playing a huge role, in helping Africa to achieve this target.
Just as a follow-up to that, sorry to interrupt, Agatha. I know we've been kind of going back and forth, but you mentioned that you really don't think that Africa is on target with that goal. And the impact of COVID-19 has, obviously hampered some of that progress that we would want to make. But do you feel that even if we're not making the necessary progress in Africa to achieve that goal, do you feel that the healthcare services, the policies, the advocacy are heading in the right direction?
Oh, yes. The truth is that COVID-19 had its own negative impact, right? But I will also tell you that COVID-19 also have its own positive impact, especially in Africa. The positive impact COVID-19 have really had is that it has really raised the consciousness of the leaders. COVID-19 has helped a lot of leaders of African countries to really understand that you might think it's so easy for you to always travel out and go and have access to the best healthcare, and you don't care about your people. They now realize that you could be in a situation where you could not even have opportunity to fly to another country. Because during the pandemic, every country locked down. In fact, they couldn't even allow flights to enter their own airspace. So that really reshaped the way a lot of African leaders think. And that helped them to begin to think there is a need to groom our own indigenous healthcare, which I think is good. That also helped to really begin to increase funding for healthcare. And one thing I would always say is that Africa has always been blessed with the best activists. Africa has always been blessed with the most powerful advocates. Africa has had people who have raised their voices, against the government, against policies, against, bringing about health promotions, right? And these things are really making progress. I'll give you a clear example of COVID-19. When COVID came up, it was many NGOs across the country, in Nigeria in specific, that raised their voices about the impact of COVID-19, even when the government was still doubting it. Even when other individuals, people were still doubting it. Non-profit advocates were at the forefront of raising their voice. And by raising their voice, I will also tell you that NGOs were at the forefront of fundraising. ACT Foundation, a Nigerian-based organization, they raised millions, over $1 billion was raised during COVID-19. And that money was galvanized by an NGO known as ACT Foundation. They brought the likes of Tony Elumelu. They brought the life of Dangote. They brought the lives of Dangote, the richest man in Africa. They brought the richest Black woman on earth. What's her name? I can't remember her name. A very amazing lady. They brought all private sectors together and raised that massive money. Hospitals were built, hospital beds and all the rest were built in less than 4 months. We saw National Stadium in Lagos turn to a hospital bed. We saw our welder, we saw fabricators fabricate different equipment, innovated different things to help protect healthcare workers. So all these were all driven by the campaign and advocacy from non-profit leaders and NGOs. So, non-profit leaders are really making a huge difference in the area of health promotion. And they are really pushing to see how these targets could really be achieved. Unfortunately, to achieve and make a huge impact or make a huge progress, you need more than advocacy. You need more than just awareness. You need more than just talk. We need political commitment. We need political will. We need the leaders. We need, even global leaders on their own to also make some commitment, to back their commitment with action. For instance, it's always so easy to say that we need to ensure that everyone who have HIV have access to antiretroviral vaccine, or to even say that anyone who really diagnosed with cancer have access to treatment. But it's really easy to say that, but have we got enough funding to really make that happen? So we can really make those kind of progress if we begin to see policymakers and healthcare leaders begin to really match their words with action and match their policy with cash backing, because without the cash, you can't really see any significant change.
So just to follow up on that, you mentioned that the government needs to take action to drive some of this change. So can you think of any regional or local policies that could drive advocacy and rights-based approaches to health promotion? And in thinking of that, are there any examples of that in your region that you feel are working or could work?
Yeah, so there are so many examples. I'll give you some example. One example is, I think about 20 years ago, health ministers from all the different African countries all gathered in Abuja. And when they met, they actually decided that every country in Africa can help to really improve health outcomes. You cannot improve health outcomes if you don't have a health system that is strong. So strengthening the healthcare system can help to improve health outcome. And you cannot strengthen health outcome if you do not finance health outcome. Financing health outcome is now connected to other issues like health workforce. And this is not me, Runcie, saying this. This is a WHO framework. When you strengthen your healthcare system, you have to think about essential medicine list. You have to think about finance. You have to think about access to this, right? So when you bring this whole together, the health ministers in Abuja met and said, let's increase our budget allocation. Everybody go back to your country. Increase your budget allocation to about 15%, so that every country can have enough fund to groom their health. Unfortunately, over 20 years ago, since that meeting happened in Abuja, very few countries in Africa have been able to meet up to that agreement. Nigerians' healthcare allocation, budget allocation today still stands less than 7 to less than 5 every year. So without that sufficient funds or sufficient health financing, you can't make a difference. Today, as I speak to you, 9 in 10 doctors in Nigeria are planning to leave Nigeria to Europe, to America, where they can find better system to work. As I speak to you today, resident doctors are on strike in Kano. So strikes are happening here and there. So this is a major example of what we can do. We know, we discussed, we agreed, but we don't have the political will to really make that progress. So if, for instance, that after that agreement, that years ago, that we've been able to see countries, more countries exactly, like, pushing their budget to 15%, the country could have sufficient funding to really ensure that maternal mortality is reduced drastically, and ensure that when women really have have to really have a baby, that they have everything that they need. Do you know today there are still some facilities across Africa where surgery is being done and they're using torchlights to conduct surgery because the hospital could not afford solar and there is a power outage. There are some communities in Lagos where people still drink from the same water where they're actually passing their feces. In Lagos, a mega city. So these are multiple issues, and we have this. The health this health example is a clear example of what we can do. Another example again is, think about COVID-19. COVID-19 came in less than 2 years. We have a vaccine for COVID-19. Is that correct? In less than 2 years, we have a vaccine for COVID-19. But do you know there are so many diseases that we've had in Africa that have been endemic in Africa for more than 10 to 20 or 40 years, and we've never had a vaccine for it? Lassa fever is a great example. Lassa fever have been killing doctors. Every year, we lose over 500 people to Lassa fever in across West African region. In Guinea, in Senegal, in Ghana, in Nigeria, we lose people to Lassa fever. There is no vaccine. Lassa fever has been killing people since 1958. We don't have a single vaccine for Lassa fever. So African leaders, especially the African Union, need to begin to galvanize within themselves and understand that the world does not care for you if you don't care for yourself. Global leaders only care for what affects them first before what affects Africa. So the moment we begin to think in that way, that is the moment we can begin to really drive progress. Not just even in achieving the sustainable development goals, but also in ensuring that people have good quality of life in our country.
Okay, thank you so much. Under a human rights-based approach, development efforts are anchored in a system of rights and corresponding state obligations established by international law. Can you tell us some laws which have been put in place to support health promotion as well as address health inequalities?
Okay, well, one thing you need to understand is that we have so many laws. We have the African Union Charter, African Union Charter, and we have the health component of the African Union Charter that really promotes gerontology, that is promotes aging health. You know, speaking to that, older people in our communities are at a lot of risk of elder abuse, right? And when they really, you see a lot of young people abusing, not even young people, even middle-aged people abusing older people, right? We have those charter, right? But some of the problems about this charter is that there is no sufficient awareness to it. There are also other, not really a human rights law or global law per se. I would not want to use that term, but I would want to say like global commitments, right? Like for instance, if you think about, I don't know if you've heard of Agenda, I don't know if you heard of Agenda 95, 95, 95, I think Agenda 1990, 90. That is a UNAIDS agenda, right? Is a UNAIDS agenda for us to see how we can like eliminate HIV, like, you know, get it at the barest minimum, right? But the issue about some of these global, I don't want to, as I said, I don't want to use global law, but global targets is that most countries travel to Geneva to sign and become signatories to these bills, but however, do not have the financial capacity to go back home and, you know, implement those, right? We also have the Berlin Conference Charter that I think happened, I can't remember the year, but several years ago, that speaks to gender-based violence, that speaks to, we domesticated that in Nigeria, and we call it the VAP Act, right? Which is the Violence Against Women Protection Act. However, that act has been accepted by an entire country. However, so many states in the northern part of Nigeria have not domesticated that act. You see the problem. So there are so many examples of global commitments. We travel for these conferences, we sign and become signatories to these targets, to these commitments. However, our political leaders have zero political will to supporting these things back home. So one thing I think we need to do going forward, especially from a human rights perspective, is for United Nations, for instance, to ensure that they continue to carry human rights activists along, and also engage people that have been impacted by these violations. For instance, engage patients, meaningfully engage patients. In terms of women, carry women along, women who have been experienced violation of their rights, women who have been abused, so that when they come back home, they could be strengthened to keep the advocacy alive.
Okay, thank you so much. Please, can you introduce yourself, Samson? Sorry, ma'am. You joined them while we were halfway through the section.
Yeah, I think she was the one having trouble with the internet, right?
Can you hear us, ma'am? Hello? Sorry, can you unmute yourself and talk to us, please?
Okay. Yes. Hello?
Yeah, we can hear you.
Hello?
We can hear you.
Okay, thank you. I'm Garmai S. Brown from Rural Women Rights Structure, Nnabuihe. Are you hearing me?
Yes, I can hear you.
Are you hearing me?
Yes.
You getting me now?
Yes, we can hear you.
Hello?
Can you hear us? Can you hear me?
I hear you now.
Okay.
Hello? Hello?
Yeah, we can hear you.
Hello?
Oh, wow. Hello?
Okay, so I said that I'm Garmai S. Brown. From Rural Women Rights Structure, Nnabuihe.
It seems like you might still be having some technical difficulties. So so for now, perhaps you just mute yourself again, and we'll continue on until you can fix it, okay?
Hello?
So we can circle around to you once you sort out your technical issues, and we'll continue on with the conversation, okay? But please let us know when you're able to join. Okay, so just moving forward, and sorry for that little hiccup there. We've been talking a lot about, how we've been making progress, albeit slow progress, that we haven't really seen the change that we might want to see in Africa, but we have a lot of gifts in Africa that can assist us with that. You mentioned that, Africa and the people that live in Africa are great advocates for change that strive for bettering themselves and bettering their communities. So like thinking about all of that, actually, Agatha, I'm going to let you tag in here because you had a question before related to using a human rights-based approach and everything. So did you want to tag in here, Agatha?
Yeah, you can go ahead.
Okay. Like under like health policy making and programming are to be guided by human rights standards and principles, and aim at developing capacity of duty bearers to meet their obligations and empowering rights holders to effectively claim their health rights. So in your perspective, what are those challenges facing both the right holders from effectively claiming health rights? So, thinking of all of this advocacy work that you've been doing, that communities have been doing, what are those barriers? What are those challenges for them to claim that health right?
Okay, thank you very much. I will list them for you. Number one is poverty. Number one is poverty versus health, right? So, you really, and anytime I speak in global platforms and I try to explain to people the intersection between poverty and health, it's always difficult to understand, because if you live in the Europe or you live in the US or you live in countries that has really a lot of good health insurance, you would not understand why someone will be sick and they will not go to hospital. You will not understand why a man can suppress mental health issue or suppress any form of, or even a woman can suppress any form of illness that they have. That is because of poverty. Poverty is forcing a lot of people across Africa that they could not go to any hospital to access the care they need because they cannot afford it. As I speak to you today, in Nigeria, less than 5% of the entire population are covered by health insurance. So when only 5% of the entire population are covered by health insurance, how do you think they would even be able to take their health seriously? Because they are hungry. They need to eat first, And when people are hungry and you are trying to tell them that excess intake of carbohydrate is not good for your body, that you need to try to mix it with egg, how can they afford that egg? How would they be able to afford the vegetables? We have so many farmers today in Africa who are the ones that cultivate fruit and vegetables, but they don't eat those fruit and vegetables. They'll prefer to sell it because they don't have money. So that is number one barrier. Number one barrier is what? Understanding and exploring the intersection between poverty and health. Number two is that we're still living in subsistence. There is a need to empower a lot of our local people in a way that they can move beyond that subsistence and start begin to think about industrialization of whatever produce that they have. Another big challenge is education. People are not educated. People don't know. And when people don't have this knowledge, there's nothing you could do to make any progress. There is nothing you could even do to have them to help to advocate, to help to drive policies, to help to even challenge policymakers. We have seen people taking their future in their hands in the Nigerians 2023 election. Now, health rights activists need to tap into what we saw in Nigerians 2023 election. Health rights activists need to study Nigerians 2023 election and see how we can model what happened there in different health issues. 2023 election is the first election where young people took their future in their hands. For the first time, we are seeing a politician who is not from any of the major parties become a front liner, become someone that even the leading parties were afraid of. This might sound political, and I know many human rights activists don't like politics, they just want to stay away from it, but we have to learn from there. And what did they do that could be beneficial to us is that you use social media. Social media was a major tool. So for us to really make a progress in terms of health promotion, we have to tap into the power of social media. Social media have become a very powerful tool. And I think people in sexuality rights have understood that. That's why sexuality rights issues are always seen on social media and trending. If you go on social media now and someone is raped and you post it on social media, you see how people are already, retweeting it, and people are really galvanizing action over it. We need to begin to find ways we can use initiatives that have worked, just as I gave an example of how social media was used in the previous election, to find how we can use that as well in our own advocacy. Another thing, again, is storytelling. It's not enough to always churn out statistics of, the number of people that die from malaria, number of people that die from this, or number of women that are affected by gender-based violence. It is important to begin to tell story about it. Put faces to it. Can we see those faces? This is one of the things we do at Project Pinglu. We do not use picture of people gotten from internet. We do not use pictures of people from any other country. We generate our own picture. We take pictures of our cancer patient and we use it. Because you want the general public, you want the people to be able to connect to this message, to connect to this information, to be able to, relate. Oh, is this not Mama Nkechi? Is it not Mama Busola? She had cancer. Hey, I have to be careful. I have to go and check my breast. So we have to begin to, tell our own story. Begin to help to connect these stories together. Mobilize people in the rural area, not just, just to know about this, but for them to also lead this campaign. So these are just the different. I spoke about the different impediments and also what we can do to really, push for progress.
Thank you so much. And so thinking of progress again, what are some, looking, 20 years from now, 30 years from now, long-term approaches, what are some of those approaches that can help improve or ascertain the impact of rights-based approaches to health outcomes? So, advocacy is something that we need to do today to push for change. But what are some of those long-term approaches that, that way 30 years down the road, we are where we want to be in health rights in Africa?
So number one, I think we need to build a strong system. right? The systems we have across Africa today are not viable, right? So what we have today is that we have very strong individuals in the system and not very strong system with individuals. So that's a major problem, it's a major gap. So you see a lot of institutions across Africa that are making a huge difference is actually that they have very strong individuals who are heading those institutions. Once those people leave, the system collapses. And if those institutions even are strong, if those institutions exist and they don't have someone who is strong or who is knowledgeable, you see those persons really drive the system to the way they want or the way they think that it should work. So we need a strong system. We need a strong system that can even run even in the absence of having whether a strong leader or not having a strong leader. That is the problem. Once we're able to have that, in the next 20, 30 years, you'll just be fine. We need to think about sustainability. Thinking about sustainability does not just, I'm not speaking to things around climate change or environment. I'm talking about sustainability in terms of our policy. Any policy that we're talking about should be something that should outlive us. I'm talking to you today and I told you that my goal is for me to lose my job. How can I be providing free screening to women across the country? I'm providing prostate cancer screening to men across the country. How can I be doing that when we can sustainably have the government institute a national screening program? And then I lose my job and the government should do their own job. We need to have that sustainability at the core of everything we're doing. If we have sustainability at the core, because sustainability talks about long-term, something that can outlive every one of us, we would definitely be able to, make a huge, huge progress. And then the last thing that I wanted to talk about is we need to create ambassadors and empower ambassadors. Think about Malala today. Anytime you think of Malala, what comes to your mind? What comes to your mind is education. What comes to your mind is, violation of rights. What comes to your mind is the challenge this lady faced. And look at what she has become, going across the world to campaign. Do we have such kind of Malala in Africa? How many Malalas do we have in Nigeria? How many Malala do we have in South Africa? How many do we have in Uganda? So we need to build Malala of our own. We need to empower young people who we see are making a difference. We need to strengthen them and give them the power to drive change. Malala, people are listening to Malala today because they think about her, they think of the pain she has been through. Today we have so many women in different parts of Africa that have been through rape, that have suffered almost 7 to 8 episodes of rape. Instead of us to empower them, what do? Is we discriminate them. So if we want to see progress in the next 10, 20 years, we need to empower those people that we think are victims and make them to become who? Heroes. I am speaking for cancer patients today, but I'm telling you, I am empowering cancer patients every single day because my voice cannot be as strong as those of the cancer patients. Their voices will always be stronger. So if we want to make a difference that will be long, that will really be long-term, that will be more sustainable, we have to empower the people we think are victims so they can become heroes. They can become heroes. If we do that, we'll definitely be able to see progress and sustainable progress.
Thank you so much. So really, and Agatha, I'm going to let you join in here, of course, as well. But do we have, is there anything else that you would like to share with us that we haven't touched on? And you know, this is your moment to shine as well. Any new projects that you want to highlight? Anything that you really want to advertise that you're proud of that we haven't had a chance to speak on?
Yeah, I mean, you know, Project Pink Blue, it's really an organization empowering cancer patients and supporting especially indigent cancer patients, you know, patients who are not able to afford care. So, you know, I would really employ anyone listening to me to really, if they can in any way, support Project Pink Blue, support our organization. Our website is www.projectpinkblue.org, and we're on social media with the same name, Project for Project, Pink for Pink, and Blue for Blue. Follow us on social media, and if you're able, you know, try to donate to us. All the money we get always go to supporting cancer patients or going to our intervention. So that's one thing I would really appeal to anyone listening to me. We need any kind of support that could come. We really appreciate it. So that's it. And Tony, that's it for me.
Well, thank you very much, and apologies for all the technical difficulties today, but I think that that's what happens when we're all tuning in from different areas of the world.
Yeah.
But I'm really glad that you were able to join our discussion today. I learned a lot myself, and I really hope that we can stay connected in a meaningful way. And if there's anything that Engage Africa Foundation can do to forward your work as well, that's what we're here for. We're here to connect all these like-minded people that are passionate for health rights and advocacy. So again, thank you very much for joining. And I know we're over time now. So I really appreciate it. And I enjoyed meeting with you. And I hope you enjoy the rest of your day.
Yeah, sure. Thank you very much, Tony. You have a great day.
Thank you.
Okay, bye.
All right, bye.